Hello, my name is Natalie Westfall, Vice President of Henry Schein Financial Services. Since the onset of the COVID-19 pandemic, Henry Schein has been a trusted source of valuable information for our customers. We've provided valuable education and real-time updates on the CARES Act stimulus package. The U.S. Department of Health and Human Services has released several tranches of funding to various categories of providers, and on June 9th, it was announced that $15 billion of the Provider Relief Fund would be allocated to eligible Medicaid and Children's Health Insurance Program providers. Joining us today is King Spalding's Mark Polston and Allison Kassir, who will provide us with an in-depth overview of the Provider Relief Fund created in the CARES Act.
Thank you so much. We appreciate the time and the opportunity to be here. We wanted to level set and put this slide up just to outline the congressional response to the COVID-19 public health emergency, just so that we could see all of the billions in one place. You will see how the funding evolved from response and vaccine development to supportive provisions for individuals to stimulus package and its plus up. With some of the provisions in these bills expiring at the end of July, there may yet be a COVID 4 package in the next several weeks. The House passed their Health and Economic Recovery Omnibus Emergency Solutions Act, or HEROES Act, in mid-May. The Senate is not likely to take up that bill, but Senate leadership has expressed a desire to take a look at the funding that has gone out the door, see if it's working, and also include expanded liability protections. Note that the program we are discussing here does not expire at the end of July. It is something where Congress put the funding in, and the program, as Mark will describe in detail, has evolved into various tranches, various requirements. And with that, let me turn it over to Mark to describe the Provider Relief Fund created in the CARES Act originally.
Thank you very much, Allison. As Allison said, the CARES Act funded to the tune initially of $100 million and then an additional $75 billion. I'm sorry, I should have said $100 billion initially. And then an additional $75 billion were appropriated by Congress to go into what has been commonly called the CARES Act Provider Relief Fund. Now, the purpose of the CARES Act Provider Relief Fund was to provide stimulus through grants or other types of mechanisms to healthcare providers who were feeling the effects of the public health emergency was caused by the coronavirus pandemic. The statute itself, in the language that appropriates the $175 billion, states that the purpose of the program is to provide these funds to prevent, to prepare for, and to respond to the coronavirus, and to give eligible healthcare providers, we're going to talk about what that means in a second, to give eligible healthcare providers the funds necessary to cover the expenses or lost revenues that are attributable to the coronavirus. Now, one limitation that's built into the statute, and we'll hear about this throughout the program, is that these funds must only be used to reimburse for expenses or losses that are that have been incurred due to the coronavirus. But if there's another source of funding out there, whether it be the CARES Act itself or some other federal source of funding, which can be used to cover those expenses or losses, CARES Act funding cannot be used to cover those same expenses or losses. In other words, the CARES Act does not allow you to double dip from federal programs. Let's talk a little bit about the definition of eligible healthcare providers, because literally when you read the language of the statute, you realize that just about anybody who provides healthcare services in the United States could be determined to be an eligible healthcare provider under the CARES Act statute and the appropriations language. It means any public entity, anybody who's enrolled in the Medicare or Medicaid program, whether they're a hospital provider, whether a physician, whether a supplier of medical services such as DME services, and of course dental services would clearly fall within this very, very broad definition of eligible healthcare providers. What is interesting, and what we'll touch upon a little bit later in this slide, is that it's not just that you have to be an eligible healthcare provider to be eligible for these funds, but you have to be one that is provided diagnoses, testing, or care for individuals with possible or actual cases of COVID. Now, we'll focus in on the word possible because possible is interpreted very broadly by the Department of Health and Human Services. And their view is that any patient today who you might provide services to, healthcare services to, is a possible COVID patient because they could be infected without you knowing it. So they're to be treated as a possible COVID patient. That's different. We'll talk a little bit about somebody who is a presumptive COVID patient, because one of the requirements for receiving these funds involves how you must bill for patients who are presumptive COVID patients. There are two different definitions, and we'll get into that in a bit. So that's generally, go back to March of this year when Congress created the Provider Relief Fund. There is now $100 billion that it needed to distribute. And the agency wanted to act very quickly. It wanted to act rapidly. It wanted to get funds out there to the healthcare community because it understood that the healthcare community was suffering, both from the expenses that it was incurring in order to address the coronavirus epidemic, such as purchasing PPE, creating new facilities temporarily where people could be treated, creating drive-by locations for testing. All those things were increasing expenses, but perhaps most significantly, because of the need for social distancing and because of the need to keep people from congregating in places where they might infect each other, many states, in fact, I think literally every state in the union was under an order to stop doing unnecessary or, non-urgent healthcare services. And as a result, all healthcare providers, whether they be hospitals, physicians, suppliers of durable medical equipment, or dental providers, for example, suddenly found that they could no longer perform the services that they were doing. So these so-called elective procedures were halted, which meant extensive amounts of lost revenue. The agency wanted to respond quickly to that. And so the first step that it took was in April, was to get out as much money as possible in what they called the first round of general distribution. What the agency did with the first round of general distribution was it took $30 billion and it gave $30 billion without any application being required to nearly 320,000 healthcare providers who had been paid under the Medicare fee-for-service program for some type of services in 2019. That was a significantly large group of providers. It included hospitals, it included nursing homes, skilled nursing facilities, home health agencies, physicians. If you had provided some sort of services and were paid for them from the Medicare program in 2019, then you received some amount of money under this $30 billion, what's been called the first tranche of the Provider Relief Fund general distribution. Significantly, because many dental providers, of course, the Medicare program does not generally cover dental services, but the Medicaid program is far more generous in terms of the coverage of dental services. So as a result, almost all dental providers were left out of this first tranche of general distribution. In addition to there being some concern about providers who, like dental providers, did not receive Medicare, did not provide Medicare services and therefore missed out on some of the distribution, a number of providers in the country were immediately critical, of the agency for distributing the funds based upon past receipts of Medicare funding. Many hospitals who were in so-called COVID hot zones at that time, New York, Detroit, and New Orleans, for example, were critical because they felt the funds, a larger distribution of the funds and they wanted to see that the funds got distributed to hotspots. In addition, as we said before, large Medicaid providers were left out, not only dental providers, but also children's hospitals who have a very, very, very low Medicare patient load. So as a result, the agency decided to issue a second round of general distribution funds we'll call it the second tranche of funding in late April of this year. And essentially what the agency did at that point in time was to say, we've distributed $30 billion. We're going to distribute an additional $20 billion to the same sets of providers who receive the general distribution funds. But we're going to base their share of payments on not just their Medicare fee-for-service billing, but we're going to base that upon their gross patient receipts or their gross patient revenues. So a second round of $20 billion was distributed to those providers who received funds in the first general distribution. Now, again, what being left out of those rounds were the Medicaid providers like dental providers and children's hospitals who had not received funding through the first round. I've described the agency's decisions about how to distribute the $175 billion of CARES Act provider relief funds as really sort of a policy decision on the part of the agency. And what I mean by that is that the agency, as we talked about the statutory language at the beginning of this session, you see there were really no rules as to who the money should go to. It should go to every eligible provider, which is defined as any provider who treated a possible COVID patient and who also incurred expenses and lost revenue as a result. The agency, through the past 3 months, has essentially distributed this money in specific rounds of funding that are targeted to certain types of providers, much of it reflecting the agency's sort of policy, desires to impact the policy under the healthcare programs. So, for example, in early May, HHS announced that it would distribute an additional $10 billion to almost 4,000 rural healthcare providers in the country. That included hospitals, rural health clinics, and rural health centers. Politically and policy-wise, that was significant for this agency, for this administration, which wants to send the message that it cares about rural providers. And so it targeted $10 billion of funds to those rural providers. But the agency had not yet really addressed the question about high impact distributions, those hospitals and those other types of facilities that are on the front line of the coronavirus. And so they developed another round of funding, which has been called the high impact distribution round of funding. That was distributed to those hospitals, about 395 of them, that had 100 or more COVID-19 patient admissions between January and April. Again, this was in order to address the concerns by those hospitals that were seeing the brunt of seeing the brunt of addressing the coronavirus pandemic, that they were not being adequately funded to address that. Many of these billions of dollars went to hospitals and in the cities I've just talked about, New York, Chicago, Detroit, New Orleans to some extent, and other major cities. So that was an attempt to address that. Since then, there has been a second round of call for high impact distribution, and the agency has made plans to distribute some of these monies out to the provider community who is who have been highly impacted by treating COVID-19 admissions. There was also an allocation made for skilled nursing facilities, about $4.9 billion in May. That was given to these skilled nursing facilities because of the perception that they were also on the front line of addressing the COVID pandemic. We've seen the stories, we've seen and many may have relatives in skilled nursing facilities and understood the impact that the virus has had on treating patients, also being a sort of stopping place for patients who are leaving inpatient hospital admissions after being treated for COVID. They maybe need a resting place on the way to entering the general population. These skilled nursing facilities have seen an uptake in patient admissions as a result of that. And then finally, on May 29th, the agency decided to issue about $500 million of funds to Indian tribal hospitals and clinics and other types of urban health centers to address the problems that they have been seeing and to provide some funding for them in response to the pandemic. Now, what's probably of most importance to this audience, of course, is the most recent round of funding, and I'm going to discuss that in a second. This round of funding, in some ways, I think could be seen as being, it's not necessarily a targeted distribution. It's not being given to providers who have significant amounts of COVID inpatients, for example. It's not being given to solely to tribal facilities, but it's a more general distribution. And that general distribution essentially is to go out to any type of Medicaid or CHIP provider. So going back to the beginning of the distributions of the relief fund, I had said that the agency initially wanted to jump out and provide as much money as possible to providers that they felt were most affected. And the best way they had of doing that was to identify all of the Medicare providers and get funds into their hands. And that's what they did with the general distribution. You see here on this slide, that first general distribution of $20 billion. HHS essentially wrapped that up and said by June 3rd, everybody who felt that they were entitled to money through the general distribution to Medicare providers had to have all their applications in by June 3rd. That date is coming past, so that general Medicare distribution timeline is now over. I also referenced earlier that there's going to be another round of funding for high-impact hospitals and other facilities that have seen a number of positive inpatient admissions from COVID. The agency has now put that in process. But most significantly for this audience, the agency has finally opened up a pipeline of funding that can be driven towards dental providers. And the way they went about in doing that was to say that they're now going to make $15 billion available from the relief funds to providers who are eligible, who also participate in the state Medicaid and our CHIP programs, and significantly that have not received payment from that first round of general fund distribution. So if you were one of the people who, one of the providers that was fortunate to be identified through the Medicare program and you receive general distribution funds there, you cannot receive general distribution funds through the Medicaid program distribution. Only those who were essentially left behind now are eligible to get those $15 billion of funds. The deadline for this application is July 20th. If you go to the HHS website or if you Google HHS Provider Relief Fund, you will be taken immediately to the page that HHS has set up for the Provider Relief Fund. And on that page, you will see essentially a number of options to click on, and one of them is for providers. And if you click on for providers, it will describe each of the various distributions or categories of distributions that I've just described. It'll talk about the general distribution and how that works. It'll talk about the targeted distributions to hotspot hospitals. It'll talk about safety net hospital distributions. And then finally, it will talk about the Medicaid and CHIP safety net hospital distributions. And so if you click on that link, it'll take you to all the applicable documents that you will need. What you will need is first, there's an application that needs to be completed and sent into the agency. That application will then enable you to enter the Provider Relief Portal and establish a username. And once you establish a username, then you can follow the application instructions to begin to provide the information that's necessary for the agency to be able to determine whether or not you are eligible for those Medicaid provider relief funds. So I'm going to transition now and talk a little bit about, at this point in time, as to what sort of the strings are that are attached to the use of these funds. Let's say that you're a successful provider. You're a Medicaid provider, you're a dental provider. You've gone in, you've identified that you are in fact an eligible provider, and we're going to talk a little bit more in a moment about exactly how you'll know whether or not you're an eligible provider if you're a Medicaid dental provider. But once you get in there, you're going to be asked to ultimately attest to a set of terms and conditions. And that's very significant for you to pay attention to what the terms and conditions require of you, because if you do not comply with those terms and conditions, there could be consequences. There could be recoupment of funds. There could even be, potentially accusations of fraudulent use of these funds. So let's spend a little bit of time going through the terms and conditions and how they work. Again, just to let you know that as you work yourself through the provider portal, ultimately at some point in time, you're going to be asked to attest to your acceptance of the terms and conditions for retaining whatever monies have been provided to you through the provider relief distribution here, the Medicaid distribution. It's obviously only for eligible providers. What we'll be talking about is in the terms and conditions, what they described as the permitted use of the funds and the non-permitted use of the funds. The terms and conditions discuss reports that you may be responsible for completing and providing to the federal government in order to let them know how you use these funds. It notifies you that you must retain records and that there may be audits in the future of how to use these funds. And then there's also a number of additional conditions upon which you accept these funds and you agree that you will not use them. So a classic one would be you cannot use them, for example, to engage in any sort of prohibited lobbying activities. You will only use them to cover your expenses and your lost revenue attributable to the coronavirus. So again, the initial tranche, or what we call the general distribution fund of providers relief funding, those providers essentially didn't need to go through a portal initially. They were just given the money. It was in their bank accounts. The Medicare program knows their bank accounts because they pay them on a daily basis. And those funds portion of those funds were just distributed in them. Those providers had to go back and agree after receiving the money that they would in fact comply with those sets of terms and conditions. And they were given 90 days from the date they received those funds to sign that attestation saying that they would comply with the terms and conditions. If they had not within 90 days, the default rule was HHS would assume that they agreed to comply with the terms and conditions. They could keep the money, but the HHS was again going to assume that they were going to comply with all the terms and conditions set forth under the program. Now, let's talk a little bit about the Medicaid and CHIP distribution that you as dental providers are now eligible for. Again, if you went to the HHS website, you're going to be provided, there are 3 to 4 sets of documents that are important for you to look at. One would be a set of instructions for the Medicaid application. The second is the application itself. The third is called, what the agency has called frequently asked questions. And there's a 37 to 38 page set of frequently asked questions that are updated on a daily basis. And when I say updated on a daily basis, I really mean that. Every day I check the website, I go back and I look to see if there's any new answer or question that's been posed by the agency and answered. Those terms that are set forth in the frequently asked questions answer lots of questions about how to complete the application. Should you be confused by certain things? Those frequently asked questions will also tell you the basics of, like, for example, who is eligible for the various distributions. And there's a portion of those FAQs that address the Medicaid and CHIP distribution. And so if you went to those, it would tell you who's eligible. Let's go over that. The providers who are eligible, again, are those who did not receive general distribution funds, i.e. those Medicare providers, and you're one of those, and you build Medicaid and CHIP, the Medicaid or CHIP programs, or you could have billed not just to a fee-for-service program, but also to a Medicaid managed care plan or healthcare related services from January through May of 31st of 2020. So those from January 2020 to May 31st of 2020. So that, of course, would include most dental providers in the United States. They'd be eligible. They probably billed to either fee-for-service Medicaid or a Medicaid MCO. They were providing healthcare-related services, and if they did it in that window, that's step one of their eligibility. So when must you apply? You have until July 20th to submit the data that's required by the application. And part of the information that that application is going to require tax information by which you will be able to demonstrate to the agency what your gross revenues are, because that's what the agency will use to determine the amount of money that you will receive from this $15 billion fund. They're looking for information on your tax revenue or your tax returns and the gross revenues from that for either calendar year 17, 18, or 19. You can determine which one you want to provide to them, but they will look at the gross revenue portion of that, and you're essentially going to be capped at 2% of your gross patient revenue. Now, the agency and the FAQs also say that the final amount each provider will receive may be affected by other data that's submitted, including information about the number of Medicaid patients that these providers serve. Now, in theory, the federal government has that information as to the number of Medicaid patients. So once you've completed this application process, they've discussed the idea of that you'll receive at least 2% of your gross revenues. You will also be asked for information about lost revenue. So in addition to providing tax return information, they will ask for you to estimate what your lost revenue was for a particular period of time. And the agency has said that when you think about estimating what your lost revenue was for, say, March or April or May of 2020, that's attributable to the coronavirus, you're permitted to look at any sort of past budgeting or projections that you had used in the prior year to take the delta between your budgeted number and what you've actually received to come up with a lost revenue amount. Now, in theory, once you've completed the provider attestation portal and you completed the application by July 20th, you will then begin to receive funds from the agency. You are not going to be required to attest at the time that you apply for the funds, but they will require you to attest to the current terms and conditions after you have complied with, after you have received the money. So let's talk a little bit about how that attestation process, again, is going to work. One thing to keep in mind is that the application that you provide and the attestation that you are going to be required to agree with is what I would call taxpayer identification number, or TIN specific. What do I mean by that? Reference back to what I was talking about with the application, where the agency wants to see your gross receipts on your tax returns. They want that by tax identification number, and they're going to provide the amount of revenue to a taxpayer identification number. So in other words, they're thinking in their minds that the eligible provider is an entity that has provided tax return through this tax identification number. So those who, wherever the bank account information that is linked to that taxpayer identification number is, that's who is going to be receiving these funds. That's also who will be attesting to these funds. So you could be an organization where you may have 2 or 3 or 4 or 5 or 10 provider numbers that all roll up into one consolidated tax return and is filed under one taxpayer identification number. That organization will be attesting to those funds, and that organization will also be receiving those funds. But if you're a provider, say for example, solo practitioner who has, his or her own individual tax identification number, you'd be receiving those funds and you would be attesting to those funds. So again, it's organization specific as focused in through the taxpayer identification number. What the attestation process really requires you to do is to say that you will comply with all the terms and conditions, and we're going to delve into those in a moment. You recognize that the terms and conditions are material to HHS's decision to give you this money. That's important because by acknowledging that you agree to comply with the terms and conditions is material to the Secretary's decision means that if you some way accused of fraudulently certifying to these terms and conditions, the Secretary says your statements there were material to me, so I therefore believe that it's fraudulent and I can pursue fraud remedies against you. The agency also wants you to know that if you fail to comply with these terms and conditions in the future, they therefore have the opportunity and the power and the right to recoup those funds from you. And then finally, the terms and conditions apply not only directly to who's receiving those, but all those subrecipients and contractors. So back to my statement about the taxpayer identification number. If you are an organization that has several different provider numbers under that tax ID, that attestation applies not only to the organization that submits the tax ID, but it's also going to be binding upon those providers who are rolled up into that taxpayer identification number. So this is just an example of the attestation process that those providers who receive Medicare funds were required to attest to back on by June 3rd. They had to attest that they were eligible because they actually billed Medicare in 2019. Remember, that was one of the conditions upon which they received their money. They had to attest also that they provided care on or after January 31st for patients who were to diagnose, test, or care for patients with possible or actual cases of COVID. Again, possible is a very expansive definition and literally means almost any patient. They also had to attest that they were not terminated from Medicare. Medicaid providers are obviously going to have to attest to something similar, and that they're not otherwise excluded from any federal healthcare programs, or that their billing privileges were revoked. So we know that this is the attestation process that the Medicare providers went through. We also know that for those providers, such as dental providers who are going to be applying for the Medicaid tranche of funds, that they're going to have a similar set of requirements that they're going to attest to. And then to, again, focus in on the concept of who's getting this money. If you are in a group practice or employed by a practice, you will not be receiving those funds. The employer organization, which is probably the taxpayer identification organization, that's who will receive those relief funds as the billing organization. If you are in a group practice, individual physicians and I guess dental providers in a group practice are unlikely to receive the individual payments directly because you probably bill through the group, and that's who the relief fund payments are going to go to. So you should look to that organization that bills, in this case, the Medicaid programs, to identify the details of the Medicaid payments that you would have received or should be receiving, to identify those accounts that would expect relief payments for you. Now, let me round up here and talk a little bit about a little bit of a deeper dive on these terms and conditions, because they are significant, and I think all dental providers should be made aware of what they say as you move through the application process and decide whether or not you want to agree to the strings that are attached to these funds. We're going to talk about the permitted use of funds, how these funds are not to be used, and then we'll talk a little bit about the balance billing concept, which is probably the most significant here. So again, the funds, according to the statute, are there for expenses that you would use, that you incurred because of the coronavirus, or you intend to incur. So a lot of this probably isn't going to apply to dental providers, but they would, as you see, with larger providers like hospitals or large physician practices, to the extent that you are retrofitting facilities, opening up new centers of operations, increasing workforce and trainings, creating space where you can isolate individuals who come into your facilities. Those would be permitted use, and those would be permitted expenses. So the funds could be used to offset the cost of all of that. And in fact, when you certify to these funds, you will be asked to certify that the relief fund payment will not be used to reimburse expenses or losses that have been reimbursed from other sources or other sources of funding. So let me pause on that because I was a bit of a quick transition. Recall now, we talked about that at the very beginning of this program that Congress appropriated these funds to offset expenses and lost revenue. I just covered the expenses portion. You still are permitted to retain these funds if your expenses do not add up to the amount of money that you receive through the relief fund, because you may have losses that far exceed the amount that you may receive from the relief fund. But as we also talked about at the beginning of the program, you're also going to certify that you're not going to use this money to pay for expenses or lost revenues that have been otherwise paid for by other programs. So for example, if you are taking part in a small business payroll protection program, or you're involved in a FEMA program, you cannot use funds that the FEMA program gave you to pay for the same expenses and then claim those expenses under the provider relief funds. Similarly, if you have a business interruption insurance program that pays you for losses, you may find yourself precluded from being able to get coverage for your business losses through the provider relief fund itself. Let's talk a little bit about balance billing. Balance billing is significant, and it's something that's confusing, and there probably needs to be a deeper dive, perhaps a program on balance billing alone. But let me explain the concept. This does not come at all from the CARES Act. This is a policy that this agency has decided to adopt as a string that's attached to the COVID-related relief funds. Balance billing essentially means, of course, that you bill the patient for the balance of what is not covered by insurance. As a result of the coronavirus, a lot of patients were forced to see healthcare providers or suppliers who were not within their necessarily within their networks. So they weren't within their HMO or they weren't within their MCO. And the agency has said that they would like to have providers who are providing COVID-related care. They are prohibited from balance billing those providers for out-of-network cost. So the example would be a physician sees a patient, provides COVID-related care to that patient. The physician cannot, the patient is not within the physician, the physician is not within the patient's commercial network, commercial insurance network. The commercial insurer pays some or a little for that, and there's a significant balance on the bill. The COVID, if that physician receives relief funds under the provider relief funding program, he or she is prohibited from balance billing the patient for those funds. And the rationale behind that is that the agency wants to, during the pandemic, doesn't want to discourage patients from going to see those providers that it needs to, even they may be blocked out of their network because some providers just no longer are available. This may or may not be a big issue for the dental community. It has happened with some significant frequency in the acute care hospital setting and in the physician setting. And I have counseled patients, I have counseled providers as to how they should identify when there may be a potential balance billing problem. But it really, the reason it may not be a significant problem for the dental community is it only applies when you're providing services to somebody who is a known COVID patient and you're provided COVID-related care, or they're a presumptive COVID patient that you're providing COVID-related care. And a presumptive COVID patient is somebody who the medical record would suggest that they have COVID, even though they don't have a positive COVID diagnosis test in their record. So since it's linked to providing those types of services, since the balance billing requirement is linked to those who are providing COVID-related care, there is probably not going to be a significant number of dental providers who are going to be caught up in the need to assess whether or not they're caught up in a balance billing problem. But the balance billing issue is significant. It's a significant term and condition for the receipt of these provider care relief funds. There are a number of other significant conditions that under the terms and conditions that dental providers should be aware of. I'll only discuss one or two more before I turn the program back to Allison. But the first one to be concerned about, I think, is, and we've already really covered it, that you're acknowledging that you're going to only use these funds to cover your expenses and losses attributable to the coronavirus. So if at the end of the day, you receive more funds than your expenses or your losses, then you may be in a situation where there may need to be some reconciliation and some return of funds go back to the agency, because you are capped at what those expenses and losses ultimately are. The second term and condition I think it's worth focusing on is that you will have to, at some point in time, provide reports to the Coronavirus Accountability Commission, or I think it's actually called the Pandemic Response Accountability Commission. This was created by the CARES Act, and it's essentially a grouping of inspector general types who will be looking into whether or not the federal government appropriately distributed funds and whether those funds are being used as required by statute. And the terms and conditions speak specifically to the fact that at some point in time in the future, the Department of HHS will provide some mechanism for you to report back the amount of funds that you received, the expenses that you're using those funds to offset, and the losses that you're using those funds to offset. So there will be some point in the time where those reports will be looked at by the Accountability Commission, and there may be some audits associated with that as well. So as you are going through and determining whether you have COVID-related expenses, whether you have COVID-related losses, always bear in mind that the time to account for those in an appropriate fashion and to make sure that you have all your documentation orders now, because if you do receive these funds, you will be preparing a report to the Accountability Commission, and there's a high likelihood that there will be some review of those. And if you cannot document your expenses or your losses, there will be some return of funds. So that sort of is it from my perspective for the high-level review of what the terms and conditions require. I'm now going to turn it over to Allison, who's going to talk about what may be coming up next for more provider relief funding. Allison, do you want to take it from here?
Thank you, Mark. And Mark, if you would advance to the next slide, when you add up all of the different components and different distributions of the provider relief fund that have been announced to date, that leaves, for those of you counting and keeping score at home, that leaves about $65 billion of the $175 billion remaining and not yet spoken for. How this remaining money is distributed is the subject of a great deal of interest, as you can imagine, from stakeholders and from members of Congress who authored and supported this funding. The members of Congress are hearing daily from their constituents about how the funds are getting out into the community, who's hurting, who's been left behind, and who needs to be taken care of in the next tranche. These members have communicated with, written letters to HHS Secretary Azar urging, in some cases, particular segments of the healthcare provider community that have not yet gotten the benefits of the fund or need to be have further attempts to make them whole. They are trying to address those specific concerns. In addition, members of Congress are seeking greater transparency in who has gotten this money, where has it gone, what's the sort of final accounting tally. And this is for a couple of reasons. It is both to understand where the funding that is in there, sitting in this fund, where it's gone, where the remainder should go to properly address what healthcare providers have had to do to respond to this public health emergency. It is intended to provide a bit of a roadmap should future additional funding be needed. And as Mark alluded to, it is important for oversight. Members of Congress, as you can imagine, want to understand where the money has gone, and to the extent their constituents or particularly segments of their healthcare community have not been taken care of, they want to know about that. And this is all relevant, sort of this understanding, this transparency. It is all relevant, frankly, because if you look in the June 9th HHS announcement, the very last line of the HHS press release notes that HHS, and we've got the quote here, is working on an additional allocation to distribute relief broadly to dentists. So it is helpful that Mark went through all of the steps and all of the strings that are attached, because there will be another, according to HHS, there will be another announcement, and perhaps not limited to just this space. There may be others. So it's important to understand how the program has evolved and developed, and stay tuned both to Henry Schein's website and to the HHS Provider Relief Fund website to see what comes next and what you are eligible for. And with that, I think that concludes our program. I don't know that there are any specific questions, but we would be happy to address any.
Thank you, Mark and Allison, for your time today. Are there any important next steps that our customers should be taking right now while we wait for more information on this topic?
Well, I'll go first with that, Natalie. I think that if you are interested in the CARES Act Relief Fund, I would definitely take a tour around the HHS website. You will not every question that anybody has will be answered. It's not as scary as it sounds, but you can easily download the instructions. You can easily download the application form and review those. That's the first place to start. Where it starts to get a little hairy is when you start going through the terms and conditions. There's a lot of legal language that's used in the terms and conditions. There's a lot of cross-referencing to other statutes and other parts of the program. And that's where I think a lot of people's concerns start to come in and start to try to understand what best it is, or to try to understand exactly what those terms mean. But yeah, I would start off with going to the website and doing a little bit of self-tutorial there.
Okay, great.
The only thing I would add is to the extent that you are finding that distributions haven't reached you yet, or you are in need of something, I always encourage folks to reach out to their members of Congress and let them know. The next COVID package is being developed. Members do want to respond, and I think that is helpful to share with them how this funding is translating in the real world.
Great. Well, thank you both very much. I'd really like to thank you for your time today and your valuable insights on this really important topic. And for our listeners, we hope you found this information to be helpful. Please visit the Henry Schein CARES Act page for access to the most up-to-date information and helpful links to learn more about the funding available through the CARES Act. Thanks for participating today.